What if the single most dangerous number for adults over 60 is not your cholesterol, not your blood sugar, not even your weight, but a number you can measure at home in 8 seconds with a $40 device? A number most people misunderstand, misread, or quietly ignore because they were told that high number is just normal at your age? That number is your blood pressure. Not in a dramatic, immediate ambulance way, not always. But statistically, blood pressure is the #1 modifiable risk factor for stroke, heart attack, dementia, kidney failure, and sudden death in adults over 60 in the developed world. And here is what genuinely concerns me after nearly 3 decades in cardiology. The threshold that doctors and national guidelines consider dangerous has been quietly revised downward multiple times over the past 15 years. The thresholds most older adults were told were fine at their last physical are often no longer fine. Tonight, we are not going to scare you. We are going to clarify. I want to walk you through 7 specific blood pressure zones every adult over 60 should understand. Number 7 through number 2 are the danger zones most people do not know they are sitting in. Number 1 is the real emergency zone where minutes matter. Before we get to number 7, I want to ask you a personal question. Drop a comment below and tell me 2 things: your age and the last blood pressure number your doctor told you. I read every single comment on this channel. Your numbers shape the videos I make next. I'm Dr. Mark, and today we are walking through the 7 blood pressure danger zones after 60. Let's begin. Coming in at number 7, and this is the zone where most damage is done because most people do not even know they are in it. Elevated blood pressure, 120 to 129 over less than 80. Let me explain why this matters so much. By elevated blood pressure, I do not mean you have been diagnosed with hypertension. I do not mean your doctor has written you a prescription. I mean a pattern. Numbers in the 120s, sometimes the high 120s, over a diastolic in the mid-70s to high 70s, showing up on a home cuff or clinic cuff over weeks. The official guideline category is called elevated blood pressure. It is not normal, and it is not high enough that most physicians will treat it with medication, which is exactly the problem. You are in the early damage zone. Multiple long-term cohort studies have shown that adults whose blood pressure sits in the 120 to 129 range over years have a meaningfully higher lifetime risk of progressing to full hypertension, of developing arterial stiffness progression, and of developing left ventricular thickening of the heart compared to adults whose numbers stay under 120. The danger of the elevated zone is not that it kills you tomorrow. The danger is that it sits quietly for 5, 10, 15 years, slowly remodeling the inside of your arteries until one day a number crosses 140 and everyone acts surprised. Practically, this is the zone where lifestyle works beautifully and medication is rarely needed. Reduce sodium to under 1,500 milligrams per day. Walk 30 minutes a day, 5 days a week. Lose 5 to 10% of body weight if you are carrying extra. Limit alcohol to no more than 3 drinks per week. Aim for 7 hours of sleep. Manage stress directly, because chronic stress elevates sympathetic tone, which elevates systolic blood pressure. None of these interventions is dramatic. Together, they are the most powerful blood pressure tools ever studied. For synergy, combine a morning walk with a 10-minute sunlight exposure in the early hours. Sunlight has been shown in published research to support endothelial function, which directly supports healthy blood pressure regulation by enabling nitric oxide-driven vessel relaxation. Number 6, and this is where most adults over 60 receive their first hypertension diagnosis. Stage 1 hypertension, 130 to 139 over 80 to 89. Here's what most people do not realize. Over the past decade, the guideline threshold for diagnosing hypertension was lowered. Stage 1 hypertension starts at 130 over 80, not at the old 140 over 90 that many older adults still remember. If your doctor told you years ago that 135 over 85 was borderline, let's watch it, and you are still telling yourself that, the science has moved on. Stage 1 is the diagnosis. Stage 1 deserves attention. According to current American Heart Association and American College of Cardiology guidance, Stage 1 in adults over 60 is associated with a meaningfully elevated 10-year cardiovascular risk. And the SPRINT trial follow-up data has informed current recommendations about who should be treated and how aggressively. The danger of Stage 1 is that it is mild enough that symptoms are usually absent. You do not feel it. You do not see it. You go about your day, but quietly, every single beat, your heart is pushing against slightly stiffer arteries than it was designed for. Endothelial damage accumulates, small plaques form. The vicious cycle of inflammation and stiffness sets a trajectory that, if uncorrected, leads toward stage 2, stroke, or heart failure. Practically, if your numbers sit in stage 1 and your doctor is comfortable monitoring without medication, then this is the lifestyle intervention front line. The DASH diet, dietary approaches to stop hypertension, has decades of evidence behind it. 6 servings of vegetables a day, 4 servings of fruit, 2 servings of low-fat dairy, lean protein, whole grains, minimal processed food, combined with the sodium reduction and walking from number 7. The combination is what moves numbers. For blood pressure specifically, the addition of a daily cup of beetroot juice or a serving of cooked beetroot has been shown in published meta-analyses to lower systolic readings by several millimeters of mercury in older adults. The mechanism is the nitrate to nitric oxide pathway. You are eating food that your body converts directly into the molecule that relaxes your arteries. Number 5, and this is the danger zone where the long-term damage clock starts ticking faster. Stage 2, hypertension. 140 and above, over 90 and above, or either number crossing that threshold. By stage 2, the immediate risk to the heart and brain begins to compound. Arteries have already lost meaningful flexibility. The heart has begun to remodel, often developing concentric left ventricular hypertrophy, a thickening of the muscular wall as the heart strains against higher pressure year after year. The kidneys begin to show microalbumin in urine as the small filtration vessels of the kidney are damaged by sustained pressure. The eyes begin showing hypertensive retinopathy signs. The brain's small vessels begin showing white matter changes on imaging years before clinical symptoms. The danger of stage 2 is twofold. First, damage compounds silently across organs. Second, the longer you stay in stage 2, the harder it becomes to reverse the structural changes that have already taken place. Practically, stage 2 is the zone where most cardiologists begin discussing medication in addition to aggressive lifestyle change. I do not tell my patients to fear medication. Properly chosen and titrated medication in stage 2 is life-saving. The goal is gradual control, with home blood pressure monitoring twice daily for the first 4 to 6 weeks after any medication adjustment. Measure in the morning before any caffeine, after 5 minutes of seated rest, with your back supported and your feet flat on the floor. Measure again in the evening before bed. Average the readings over 7 days. Bring that log to your appointment. No cardiologist wants a single frantic reading from your doctor's waiting room. I want to share a patient story here because this is the one I think stays with people. I'll call him Walter. Walter was a 68-year-old retired mail carrier from Boise. He came to me after a routine physical showed 152/94. He had no symptoms. He was active, walked 4 days a week, and ate reasonably well. He told me, "My dad had 150/90 for 20 years and lived until 87. That is the kind of sentence I hear all the time, and it is the phrase that worries me most. We started low-dose combination therapy and aggressively worked on sodium reduction, sleep, and walking volume. 6 months later, Walter was consistently sitting at 128/78. He told me, "I wish I had not waited until it scared me." That sentence is the entire message of today's video. Number 4, and this is the pattern that is uniquely common in adults over 60. Isolated systolic hypertension, systolic 140 or higher, diastolic still under 90. Let me explain why this pattern is so distinctive. After age 60, the diastolic number, the bottom number, often stops rising and may begin to fall. The systolic number, the top number, however, climbs steadily because the large arteries have lost their natural elasticity. Collagen in the arterial wall increases. Elastin, the stretchy protein that younger arteries are full of, breaks down. The artery becomes a stiffer tube. Each heartbeat hits a rigid wall instead of an elastic one. The pressure inside the arteries during the squeeze of the heart rises higher. Between heartbeats, the artery cannot recoil as much, so the pressure falls lower. The result is a high top number, a relatively normal bottom number, and what we call a wide pulse pressure. Isolated systolic hypertension is the most common form of high blood pressure in older adults, and it carries independent risk for stroke, heart failure, and cognitive decline. A landmark study, the SYSTURE trial, established decades ago that treating isolated systolic hypertension in older adults significantly reduced stroke incidence. The danger here is that many adults and even some clinicians focus on the average of the two numbers rather than the top number alone. If your systolic sits at 150, but your diastolic is 78, your average is 114, which sounds fine. It is not fine. The systolic alone is doing the damage. Practically, measurement discipline matters more in this zone than in any other. Home cuffs are accurate for systolic readings if the cuff size is correct and you measure after 5 minutes of seated rest. Bring a printed 7-day log to your cardiologist with both numbers visible and let the systolic number guide the conversation, not the average. For lifestyle change here, the priority is reducing arterial stiffness, and that includes a combination of aerobic exercise, controlled resistance training, potassium-rich whole foods like leafy greens and bananas, and aggressive blood pressure control through whatever combination of lifestyle and medication your cardiologist prescribes. For synergy, dietary nitrate from beetroot and arugula supports the nitric oxide pathway that helps arteries relax, addressing the underlying mechanism rather than just the symptom. Right here between number 4 and number 3, I want to ask you directly, if this information is making you rethink how you have been handling your blood pressure over the past 5 or 10 years, if you realize you have been told a little high but fine for your age, please hit the like button right now and subscribe to this channel if you have not already. Every week I publish videos that translate this kind of science into something you can actually use at home. Your support is what keeps this work going. Thank you. Number 3 now, and this is a zone that most patients and frankly most general physicians never explicitly discuss: wide pulse pressure, a top number and bottom number that are more than 60 millimeters of mercury apart. Here's what most people do not realize. Pulse pressure is the gap between your systolic and diastolic readings. If your blood pressure is 150/80, your pulse pressure is 70. If it is 160/75, your pulse pressure is 85. That gap is itself an independent marker of cardiovascular risk, particularly in adults over 60, independently of what either individual number is doing. A wide pulse pressure reflects stiffened large arteries. It reflects a heart that is beating against a non-compliant system. Published cohort studies, including long-running Framingham Heart Study analyses, have shown that pulse pressures above 60 millimeters of mercury are associated with elevated risk of coronary events, heart failure, and all-cause mortality in older adults. Pulse pressures above 80 millimeters of mercury carry even higher risk. The danger of this zone is that it hides inside otherwise normal-looking average blood pressure numbers. A reading of 145/82 has a pulse pressure of 63 dom. Sit with that for a moment. That is a meaningful red flag, even though each individual number is not screaming. Practically, if your pulse pressure is consistently above 60, the conversation with your physician needs to explicitly include that measurement. Don't let your blood pressure is fine be the summary of a visit when your top and bottom numbers are wide apart. The treatment priorities here overlap with stage 2, an isolated systolic hypertension, reducing arterial stiffness through a combination of aerobic exercise, controlled resistance training, and, where appropriate, medication. The good news is that nitric oxide supporting nutrition has been shown in published research to modestly reduce arterial stiffness and improve pulse wave velocity, the gold standard measure of arterial flexibility. Beetroot, arugula, dark leafy greens, dark chocolate with 85% cacao or higher, and pomegranate all have evidence behind them. You are working not just on the number, but on the underlying biology. So, number 2, and this is the zone where most heart attacks and most strokes in older adults actually happen. Often without anyone knowing their blood pressure was a problem. The dawn surge and blood pressure variability. Here's something that most patients never hear from their doctor. Most cardiovascular events do not occur evenly across the day. They cluster. In adults over 60, the hours between 4 a.m. and 10 a.m. carry the highest concentration of heart attacks, strokes, and sudden cardiac deaths. The mechanism is biological. Cortisol rises in the early morning hours. Sympathetic nervous system activity increases. Blood pressure pressure naturally surges upward upon waking. In a healthy elastic arterial system, this surge is gentle. The systolic rises from 115 to 125 across the morning, and vessel walls handle it without damage. In a stiff, hypertensive system, the same surge pushes systolic from 145 to 165. The heart faces a sudden mechanical load increase. Plaques that were stable become vulnerable. Small vessels in the brain, already weakened by years of high pressure, may rupture. This is the dawn surge, and it is also why the first hour after waking is often when patients feel chest tightness, lightheadedness, or unusual fatigue. The second concept in this zone is variability. Blood pressure that swings 128 one day, 158 the next, 142 the day after, is more dangerous than blood pressure that is consistently elevated. Published research has established that higher systolic blood pressure variability is independently associated with stroke, cognitive decline, and cardiovascular events, even after accounting for the average blood pressure. The danger of zone number 2 is that standard in-office measurement almost never captures it. Your doctor sees a 138/86 at 2 p.m. after you've been sitting in the waiting room for 40 minutes. That is not the moment that explains why you had a stroke at 6 a.m. on a Tuesday. The fix is not dramatic. 24-hour ambulatory blood pressure monitoring, which your cardiologist can order, captures the dawn surge, the variability, the nighttime dipping pattern. If you have ever been diagnosed with hypertension on a single office reading and felt unsure, ask for a 24-hour monitor. For lifestyle, the protocol is specific. Do not roll out of bed and immediately stand, scroll your phone, drink coffee, or jump into high-intensity exercise. Allow 30 minutes, sit up, sip water, move gently. This blunts the morning surge rather than amplifying it. Take your medication, if any, in the evening rather than the morning, but only on your cardiologist's instruction, because the timing debate is real and individual. The most evidence-supported morning setup is simple. Wake, sit, hydrate. Walk slowly, eat a deliberate breakfast. Do not start the day at full throttle. Right here I want to share one more story, because the dawn surge zone is the one where patients most often tell me, "But I felt fine the night before." I'll call her Patricia. Patricia was 71 from Sacramento, lived alone, daughter worried about her living alone. She came to me 4 months after a small ischemic stroke that occurred at 5:40 a.m. on a Wednesday morning. Her in-office blood pressure at the follow-up was 138/82. Decent. Her 24-hour monitor told a different story. Her morning surge between 5 and 7 a.m. routinely pushed systolic above 165. Her nighttime dipping pattern was abnormal. Within 2 months of evening medication timing, aggressive morning lazy wake protocol, and DASH diet discipline, her morning surge softened. Patricia told me, "I felt fine before the stroke. Now I understand why that doesn't matter." That sentence is the point of number 2. And now we arrive at number 1, the real danger zone, the one where minutes matter. Hypertensive crisis, blood pressure reading higher than 180/120 with or without symptoms. Stop what you are doing and listen carefully. The number itself, 180, 200, 215, 220/120, 125, 130, is not the only signal that matters, but it is the threshold that triggers a different category of risk. When systolic blood pressure crosses 180, with diastolic crossing 120, the small vessels of the brain, the small vessels of the heart, the small vessels of the kidneys, and the eyes are being damaged in real time. Endothelial injury accelerates. A plaque that was stable can rupture. An aneurysm that was intact can dissect. The brain's small arteries can leak. This is the actual danger zone the title of this video promised. Now I need to distinguish 2 scenarios carefully because they are different. First, hypertensive urgency, blood pressure above 180/120, no symptoms, acute end organ damage not yet occurring. This is still a medical emergency that requires evaluation within hours, but it is not the same as actively dying. The treatment is not drive to the ER. The treatment is call your physician, go to urgent care, or depending on availability, the ER for oral or intravenous medication to gently bring the pressure down over hours rather than minutes. Second, hypertensive emergency, blood pressure above 180/120 and one or more of these symptoms. Severe chest pain, severe headache unlike anything felt before. Sudden vision loss or blurry vision, slurred speech, numbness or weakness on one side of the body, difficulty breathing, confusion, seizure. Any one of these with a high reading is a 911 call. Not a phone call to your son, not a phone call to schedule an appointment for next week, a 911 call. This is the actual danger zone. The reason it matters to know before it happens is that the people around you, your spouse, your adult children, need to be able to take action while you may not be able to. Here is what I want every family to know. Memorize 3 words: chest, headache, side. Chest means chest pain. Headache means sudden severe headache unlike anything before. Side means numbness or weakness on one side of the body or face drooping. Any one of those 3 with a high reading is a 911 call immediately. Not in the morning, now. The danger of this zone has nothing to do with whether your blood pressure has been controlled or not. The danger has to do with whether the people around you know the rule when it counts. Practically, post the 3 words on the refrigerator door. Put them in your phone's medical ID. Tell your spouse tonight. Tell your adult children this week. The act of preparing now is what allows calm action later. I want to share a final patient story because this one saved lives through the family, not the patient. I'll call him Edward. Edward was 76. He retired electrical engineer. He had been on blood pressure medication for 15 years. He had a home cuff but rarely used it. He had a wonderful, attentive wife. One evening, his wife noticed he was unusually quiet and that his face looked, in her words, off. She did not see chest pain. She saw face drooping on one side. She remembered a brief conversation from one of her friend's medical appointments about the word side. She called 911 within 4 minutes of noticing. The ambulance arrived in 7. The hospital confirmed a stroke. Because of the 4-minute decision, Edward received clot-dissolving therapy within the therapeutic window. He recovered nearly fully. His wife told me, "I did not save him. I just did not waste time." That sentence is the reason number 1 exists. Here is what I need you to take away from this video before we close. Blood pressure is not one number. It is a system with stages, patterns, alerts, and emergencies. You have now walked through 7 of those zones. The elevated zone where most damage begins silently. The stage 1 zone where most diagnoses happen. The stage 2 zone where organ damage compounds. The isolated systolic zone unique to adults over 60. The wide pulse pressure zone hiding inside average-looking numbers. The dawn surge zone where most heart attacks and strokes happen. And the hypertensive crisis zone where minutes, need not hours, matter. 1 home blood pressure cuff. 1 30-minute morning protocol. 1 printed 7-day log every month, 3 memorized emergency words on the refrigerator. That is the entire system. It costs less than a single copay. It does not require dramatic lifestyle change. It requires attention, consistency, and the willingness to act on the information your body is already giving you. Your arteries are feeding your brain and your heart every single second of every single day. They are not asking for anything complicated. They are asking for measurement, awareness, and follow-through. I'm Dr. Mark, and I have spent 3 decades taking care of adults in their 60s, 70s, and 80s. The patients who did best were never the patients with the lowest numbers on the page. They were the patients who paid attention to the pattern, who asked the next question, who brought the log to every appointment, who told their family the 3 words. Prevention is not dramatic. It is patient, it is consistent, and it starts tonight. Thank you for spending this time with me. If this video helped you, or if you know someone over 60 who needs to hear it, please share it. Stay curious, take care of yourself, and I'll see you in the next video.